Good morning. Today I'll be presenting a lecture on skeletal maturity indicators. As we all know that optimum timing for our growth modification procedures in orthodontic is during pubertal growth spurt. Okay, and if then again the importance of pubertal growth spurt lies is once I want to do orthosurgical treatment. That is, if a camouflage is not possible, say for class 3 malocclusion, we would like to go for orthosurgical procedure. So we would have to see what is the pubertal growth status, what is the growth status. So that growth has to be completed when we go in for any orthosurgical procedures. Now, how do we see various indicators of skeletal age? We can visualize it with the help of hand wrist radiograph with cervical vertebrae, canine calcification stages, or frontal sinus. Now, hand wrist, this is the oldest technique. The main drawback was that an additional X-ray was needed. So children, because generally in orthodontic, when I want to see a pubertal growth spurt, they are the growing children and we have to unnecessarily expose them to the radiation. Now, coming briefly onto the anatomy of the hand wrist radiograph, we should know what is metacarp. These are the bones, as you can see, scaphoid, C for capitate, T for trapezius, and lunate, radius, ulna. These are the important bones. These are the metacarpals, as you can see, phalanges. So between them only we'll see what is, depending on the growth status of these individual bones, different stages have been shown about the growth progression in an individual. Now, what methods we'll be discussing today will be Atlas method by Gurish and Pyle, Bjork, Grave and Brown method of Fishman skeletal maturity indicators. Now, coming on to first the Bjork, Grave and Brown method. Now, Bjork, Grave and Brown gave 9 developmental stages depending on 3 stages of ossification in the phalanges. The first stage was that epiphysis width is same as the diaphysis, as you can see in this figure. Epiphysis width is same as diaphysis, that we denote by the sign equal to. Then capping stage, where epiphysis surrounds diaphysis like a cap, we call it a cap stage. Union stage we denote by U, where there is a bony fusion of epiphysis and diaphysis. Now, coming from those 9 developmental stages, coming on to the first one. Now, coming on to the first stage. First stage was PP3, where there was a proximal phalanx had epiphysis equal to diaphysis. Now, second stage is MP3 is equal to where epiphysis of the middle phalanx of the middle finger, they are equal to, as you can see in the figure. The third stage, this is characterized by 3 areas of ossification. As you can see in the first figure, this is an area of ossification of hamellar process of hamate. Then this is appearance of pisiform. And the third one is where epiphysis and diaphysis. This is a epiphysis and diaphysis of the radius are equal to. That is of the same width. The fourth stage, this is stage marks the beginning of the pubertal growth spurt. It is characterized by initially by the mineralization of sesamoid bone of the thumb. Second, there is an increased ossification of hamellar process of hamate bone, as you can see in this figure. Now, fifth stage, this marks the peak of the pubertal growth spurt. So in this, there is a capping of diaphysis by the epiphysis, which is seen in MP3, that is middle phalanx of the third finger, proximal phalanx of the first finger, and in radius. So you can see if we see capping in any of these middle phalanx, proximal phalanx, or the radius, we'll call it as fifth stage, that is the peak of pubertal growth spurt. Now, sixth stage. This stage signifies the end of pubertal growth. It is characterized by, now we are on the deceleration phase, that is growth is going to end. It is characterized by union between epiphysis and diaphysis of distal phalanx of the middle finger. This is called as DP3U. Now, seventh stage, as you can see, this is a proximal phalanx, third finger ka proximal phalanx, that is having a union of epiphysis and diaphysis. Eighth stage, where we have a union of middle phalanx of the third finger, that is the eighth stage. And ninth stage, which marks the completion of the growth, is the union of epiphysis and diaphysis of the radius. So these are the stages which were given by Bjork, Grave and Brown. Now, next is your Fishman maturity indicators. He made a use of 6 anatomical sites rather than taking all the fingers. One was the thumb, then is the third finger, then is the fifth finger, and the radius. So, depending on the stages of this, in these 4 anatomical sites, he gave 11 stages. Now, you can see these are the sites which I have told you just now. Now, what he used was the 4 stages of vein formation as used by Bjork, Grave and Brown. One was width of the epiphysis equal to diaphysis, and then we have a capping of epiphysis to the diaphysis. Third, appearance of an ossification of fused structure, say like sesamoid bone, or the hamate. Then fusion, where epiphysis fuses with diaphysis. So based on these 4 stages of bone maturation, they gave 11 stages as a skeletal maturity indicators by Fishman. Okay. So you can say these are the finger. This is a finger where we have represented all the stages. You can say this is a middle phalanx, third finger, proximal phalanx when epiphysis is equal to diaphysis. That is stage 1. Then we have stage 2 where the middle phalanx of the third finger is having epiphysis equal to diaphysis. Then third is the fifth finger where we have a middle phalanx equal to where the epiphysis is equal to diaphysis for middle phalanx of the fifth finger. Okay, so these 3 stages, as you can see, these are categorized based on the width of the epiphysis. Then we have a stage 4 where there is appearance of sesamoid bone. Then capping, when we talk about capping, we have distal phalanx of the, this as you can see, this is a distal phalanx of the third finger. Then we have the middle phalanx of the third finger capping, and then we have a middle phalanx of the fifth finger that is having a capping, epiphysis capping the diaphysis. Now next 4 categories will be within the fusion where we have, as you can see, this is a distal phalanx of the third finger, then there is a proximal phalanx of the third finger, then the middle phalanx of the third finger. You can see 8, 9 and 10. Okay, so this is a distal, then proximal, then middle phalanx. So fusion of epiphysis and by diaphysis in this will be categorized almost close to growth completion. And as we have said about Bjork, Grave and Brown, the union of epiphysis and diaphysis of the radius will indicate the completion of growth. Okay, now coming on to cervical vertebrae maturity indicators. It was initially Lamprasky had given them, then they were modified by Hessel and Forman. The main advantage of cervical vertebrae maturity indicator is that you don't have to take any additional radiograph. As we all know, for any fixed orthodontic treatment, we need certain essential diagnostic aids. Among that, lateral cephalogram is one. Means ki whoever is coming for fixed orthodontic treatment, we have to take this lateral cephalogram, and that same lateral cephalogram we can use for assessing the growth status of an individual. Okay, so these ossification events, they begin early during the fetal life and they continue till our adulthood. So based on this, we can know what is the right age for instituting a growth modification procedures, or if we want to do orthosurgical procedure. The main disadvantage is at times they go very minor changes over a period of time, and if a person is not experienced, then it is difficult to identify those differences. Next, improper positioning of neck, not having an upright position during making of an radiograph. Sometimes the visualization of the morphology of cervical vertebrae C3, C4 and C5 is difficult. Now, what are the different methods? They are a Hessel-Forman method, McNamara, Bassett and Franchi method. Okay, Hessel and Forman method, this was given in 1995. We defined 6 categories. First was initiation, where inferior borders of second, third and fourth vertebrae were flat at this stage. Okay, so the third, as you can see, third and fourth vertebrae, they are almost wedge shaped. That is the part they are slope from anterior to posterior. You can see they are sloping downwards, tapered from posterior to anterior. So this is the stage where 100% of growth is remaining. Okay, then we have acceleration, where you can see the concavities are seen at the lower border of second and third vertebrae. Right? So inferior border of the fourth vertebrae but still remains flat, and these start becoming slightly rectangular from the wedge shaped as we had seen in the stage 1. So this is the stage where 65 to 85% of pubertal growth is remaining. Then transition, here distinct concavities are seen on the inferior border of second and third cervical vertebrae. Even a concavity starts on the lower border of the C4 vertebrae. So this is the stage where 25 to 65% of pubertal growth remains. And this is the stage where we assume the peak of the puberty. Acceleration, we said the person is around puberty. Transition, we find that the patient is at the peak of the pubertal growth spurt. Okay, now next is a deacceleration stage where distinct concavities can be observed on the inferior border of second, third and fourth cervical vertebrae. the vertebral bodies, they become more squarish in shape, and this is the stage where 10 to 25% of pubertal growth remains. Then we have maturation stage where marked concavities are seen for C2, C3 and C4 vertebrae. Vertebral bodies of third and fourth are almost square in shape and 5 to 10% of growth remains. And they are almost square, but you can see they are horizontally, they are more wider than what they are vertically. In next stage, the completions, you can see that the vertebrae, they become slightly elongated in the vertical direction than horizontal. That marks the completion of growth stage. Now we have dental calcification stages. This is the canine calcification stage, which were based on the stages by Demerjian and Nolla. The canine calcification stages are seen. So what stages are of importance to us are stage F and G. Canine stage F indicates initiation of puberty. As you can see, the Hartwig root sheath has just begun to form. And this is like root has just started to form. Stage G, it is indicative of peak height velocity, pubertal peak or pubertal growth spurt. The studies have been done and they found that it coincided with the capping of MP3, that is middle phalanx of third finger, and presence of adductor sesamoid. So there you can see 2/3 of the root is completed for the canine. So this is indicative of stage G, that is the peak of puberty, peak height velocity. Now based on, as we have seen that in hand-dress radiograph, main disadvantage was that we had to take an hand-dress radiograph, patient has to be exposed to the additional radiation. Okay, which is like in children, it is almost contraindicated nowadays. So what we can do is just we can take the IOPA of middle phalanx of the third finger. This was given by Rajgopal and Kansal, and then we can see the stages on that middle phalanx of third finger. As you can see, this is MP3F stage, where epiphysis is still smaller than diaphysis. This is just an initiation of growth. Then this is FG stage where it becomes equal. Then you can see at G stage where it is starting to cap. Then MP3H stage where the capping is more pronounced. HI union is starting, and MP3I stage where the union has occurred. Okay, so this is all about stages that were given. So if you can on IOPA, that is one good thing. Another thing you can see is on the lateral cephalogram, and these things are very important because when a patient is coming of 8 years, I don't know whether I have to give a myofunctional or an orthopedic appliance. So what would I like to do is that I will check for his growth status. Even lateral cephalogram is not needed at that time. So MP3 will be a better choice. We'll just take an IOPA. We'll know the growth status of an individual, correlating it with the second appearance of secondary sexual characteristics in individual, considering the gender of the patient. If it is female, I'm expecting a pubertal growth spurt little early compared to boys. So that is how I'll decide whether this is the right time for me to start a myofunctional appliance. Because especially in class 2 malocclusion, it is now preferred that we give a myofunctional appliance when the patient is on the puberty. Why it is so? So that we can so that there is no burnout of the patient, because patient is at puberty, mandibular growth will occur faster. What were the hindrances that didn't allow the mandible to move forward will be removed. Once we remove them, mandible will move forward. So as we all know, all myofunctional appliances, with that we are not increasing the length of mandible, rather we are optimizing the conditions for appropriate growth of mandible. So this is what is needed when we are talking, when this is what we expect from skeletal maturity indicators. Thanks a lot.